and welcome to the Nursing Assistant class. My name is Jennifer Murphy and I am the instructor for the course today. We will be discussing the basic concepts of nutrition as well as practicing the skill of feeding the client who is not able to feed themselves or needs assistance with feeding. We will start our presentation today with the lecture using the PowerPoint slides that have been designed by NWTC for all of the nursing assistant classes. And let's get started here. So the first slide here discusses the definition of nutrition, which is the process involved in ingesting food and then digesting it, as well as absorbing the nutrients into the body. And of course, nutrients are categorized into several different groups. Of course, we're most familiar with our fats, proteins, and carbohydrates, but also the vitamins and minerals that come from that, as well as the use of water for hydration. And in the essence of the skill that I am practicing, which is taping this, we're going to skip through obviously some of these PowerPoints to condense the material. So factors affecting eating and nutrition, and students, if you wouldn't mind opening your your textbooks to page 265. Obviously, we're working in long-term care, which does require us to have knowledge regarding the changes that occur with age. And in your books on page 265, we'll discuss some of those. If, Brooklyn, if you wouldn't mind reading one of those changes that occurs with age.
Changes with aging. Salivary glands produce less saliva. This can cause difficulty swallowing, taste and smell dull, and this may decrease appetite.
Absolutely, and some of the processes that are the changes that occur do affect obviously our ability to eat as well. So not only do some of the senses dull, but also biochemically or chemically we're not able to process the food the way that we need to. So we are at higher risk for things such as aspiration. If we are not able to produce as much saliva and break down the food the way that we normally do, the food does not remain or does not liquefy, and we are at risk if we're not able to swallow it as well. For example, if someone has a stroke, or if we're not able to swallow it as well, we are at risk for aspiration, or that client is. So Kayla, would you mind reading another change that occurs?
Loss of teeth and ill-fitting dentures cause chewing problems. This causes digestion problems. Hard to chew foods and are avoided. Ground or chopped meat is easier to chew.
Okay, so again, we're going to make some changes that are necessary to help swallowing and make it safer for the client to be able to eat without increasing the risk for aspiration. We can't eliminate that completely, but we certainly do our best, not only with the way that we prepare foods, but also the utensils that we use to feed our clients with, to keep them as safe as possible with still providing the best nutrition possible. Some of the other things that affect nutrition and feeding clients are their cultural preferences. Certainly their food choices or their methods of cooking, as well as the different spices and sauces that they use in their own foods, will affect when they're in a long-term care setting whether they certainly like the food or not, or whether they feel that it's even okay for them to eat if there's religious preferences involved as well. So students, do any of you have any cultural experiences that you could share, or religious experiences or limitations or things that you think might affect feeding a client or nutrition? We do have in our culture in this area for sure many people who belong to the Roman Catholic religion. I think a lot of people are familiar with during the Lent season on Fridays not eating meat, and at certain holy days abstaining from eating foods for a certain amount of time, or fasting for a certain period of time altogether. And those choices, again, we have to remember that those will affect the food choices that our clients have. Anybody have anything to add to that? I do have something that I had actually looked up because I was not too familiar with some of the other things that affect cultural food preferences. So I actually just learned about this myself today. This is actually in regards to the Buddhist culture that say many Buddhists are vegetarians, and some include fish in their diet, but they usually do not eat meat, and they abstain from all beef products. In the Hindu culture, Hindus do not consume any foods that might slow down spiritual or physical growth. So the eating of meat is considered to do that, and it is not prohibited. But the eating of meat is not prohibited, but pork, fowl, ducks, snails, crabs, and camels are avoided. To Hindus, apparently the cow is sacred, so they do not consume beef products. And they do relate that to, obviously in our culture, dogs are considered sacred, and we do not participate in eating the meat from dogs because they are considered sacred animals. And it's the same thing for cows in the Hindu religion. A couple of other interesting things here. Mormonism, they choose foods that build up the body, improve endurance, and enhance intellect. So they consider products from the land such as grains, fruits, vegetables, and nuts to take the place of meats and sugars and cheeses and spices, and those things should be avoided in their diet. There's also rules of abstinence for things such as alcohol, coffee, tea, and chocolate. So obviously it'll depend on their own personal preference and how much they allow their religion, obviously, to dictate their diets. But these are obviously concerns and things that we need to consider when we're feeding the client and providing nutrition for them, especially in an environment where they usually do not have the options or large options for controlling what they are able to eat. It's usually, here's a few different choices, and this is what you have to live with. Also, Rastafarianism, I found this interesting, is they eat things that are only cooked slightly, so meats are not consumed, nor are canned goods, or they're at least avoided. Drinks are natural and not allowed. Fish under 12 inches long may be eaten, but other types of seafood are restricted. So very, very interesting material for sure. Also, too, because we're, again, working mostly in the long-term care setting, we are dealing with people who are undergoing the end-of-life process, and we do see changes that occur with that as well. The gut does tend to slow down, and most of the energy that the body does have tends to go to the vital organs and the things that it needs to still stay alive. So we do see that people's appetites tend to decrease dramatically, and their bodies do not accept food as well as it used to, or fluids, and because of that, it makes it difficult for the caregivers and sometimes the family members to kind of wrap their minds around it, because nutrition is thought of as healing. However, we do see, as a former hospice nurse too, when we are kind of forcing people or thinking that it's going to bring them back to a healthier state, that it actually ends up causing more problems with nausea, vomiting, bloating, and things that make them more uncomfortable. So we often do discuss with members, or at least the nurses that are working with the clients, these changes that they can expect to occur and how they can help support their loved ones in the end-of-life process in regards to nutrition and hydration. So lastly, we're going to finish up a couple more things on the PowerPoint here, and then we're going to watch a video demonstration on feeding the client and get into that here. We talked about religion. Of course, OBRA itself does have dietary requirements that are enforced through the cooks and the chefs and the people that provide the nutrition in the facility. Also, special diets. We do need to have some basic knowledge regarding the special diets that are given through orders by physicians. And these are diets that basically a regular general diet is a client is allowed to basically have anything that they would like. There are patients, however, hypertensive patients, congestive heart failure patients, that do need a sodium restriction in their diet, and that is one of the types of diets that we see commonly prescribed in the long-term care facility. Of course, diabetic diets are typically used to control the amount of carbohydrates that a person receives if they're diabetic. And then for patients that have difficulty swallowing, either due to strokes or other conditions, a dysphagia diet. And a dysphagia diet is basically a diet that allows a person to still receive nutrition through a special way, either through the utensils that we use or other tricks of the trade, such as a chin tuck maneuver to help assist them in swallowing their food so that they do not aspirate. So we only have a couple minutes left here. We are going to practice our skill today. I will show you the video that we typically show in the nursing assistant class, and if you wouldn't mind pointing the camera this way. We're not going to watch the video, obviously, for the purposes of this demonstration for my project here, but we do use at NWTC the Mosby's Nursing Assistant Video Skills videos or DVDs and CD-ROMs that come with this. And we do view these in class to help assist our students with properly learning how to assist with eating and feeding the clients who are not able to feed themselves. So Kayla, if you wouldn't mind handing me the camera here, I'm going to help guide and coach you both through feeding the clients. And one of you is going to assimilate being a client and the other one is going to be a caregiver. So when we are practicing these skills that we need to learn for our nursing assistant jobs, we do need to test using the Pearson VUE test book, and these list the skills in there as far as feeding the client who cannot feed themselves, of course, and we will practice the skill using this. Once you feel comfortable practicing the skill, then we can go on and actually test out on the skill for the class so that you can go on to do this in clinicals. So one of the first things that we'll do, and I will read this as we go along, we'll actually assimilate this by having one of you blindfold yourselves to assimilate the blind patient or the patient who is not able to see either due to macular degeneration or some other thing. So Kayla, one of the first things we're going to do, we always do, is wash our hands, of course. So we're washing our hands, and then before feeding, we're going to pick up the name card on the meal tray and ask the client to state their name.
Can you please state your name?
Brooklyn Murphy.
Wonderful. So are there any diet restrictions listed on the card?
It says general.
General diet. So we have a regular diet. We don't have to restrict our food eating. And Kayla, if you wouldn't mind setting up the tray, we're going to reveal what's going to be for lunch here today. And very quickly, Kayla, we're going to have you place the clothing protector on Brooke's lap, or actually below her chin, so that we can keep her dry and clean here. And also, we'll run through the rest of the steps here. One of the things that we use are a clock. Well, actually, if someone is able to, it just needs assistance with, we can use the clock method to describe what locations the foods are listed at. So, Kayla, if you want to feed Brooke some applesauce, we'll start with the applesauce there. And again, we're going to follow the steps listed in Pearson VUE and use that as a guide in the skills booklet here, so that when you do your testing, we will have a strong hold on what Pearson VUE testers are going to be looking for when you test out. So go ahead, Kayla, if you want to describe using the spoon, offer her a bite of one type of food, or explain to her what's on the plate and ask her what she would like first.
Okay, Brooke, what would you like first?
What are my choices?
We have applesauce, potato salad, or chicken.
I'll do applesauce. I prefer small bite sizes, please.
Okay.
Very nice.
And you can open your mouth. Good job.
That's delightful.
All right, so again, using the booklet, the Pearson VUE booklet, we can offer the fluids and the foods that we need for the proper nutrition that our clients will be receiving. And we will finish with testing out on the skill once the students feel that they are competent in that skill. And from there, the rest is history. So they will go to state and test out and do fabulously well. And we will see them working in our workforce later on down the road. So thank you very much. This concludes my presentation.